So the last topic of the first unit is pharmaceutical dosage forms. Let's see now what are pharmaceutical dosage forms and what is a pharmaceutical dosage form, what is the use of the pharmaceutical dosage form, everything let's see now. So you see what is a dosage form first of all. First of all, pharmaceutical dosage form. Before going into pharmaceutical dosage form, first of all, you should know what is a dosage form. So dosage form is nothing but it is defined as it is a physical form of the drug. It is a physical form of the drug or a structure of the drug. It may be a solid or it may be a liquid or it may be a gaseous form which can be delivered to particular site within the body. To particular site means what? Particular site in the sense it may be through the mouth, that is oral route, or it may be through the injection, that is parenteral route into the body. So this is dosage form. So dosage form is nothing but dosage form is defined as a physical form of the drug, a physical form of the drug that may be a solid or that may be a liquid or that may be a gas which can be delivered in proper form to the particular site of your body. So that is called as dosage form. So what is the need for a dosage form? So the need for a dosage form, see, if there is no dosage form, if you have to take with the powder, so you can't take directly the drug particles as powder or drug particles as crystalline solids. So that is why a dosage form is needed. So what a dosage form will offer you? A dosage form will offer you the protection from the external environment. First thing, protection from the external environment means what? See, the drugs are always, it may be powders or it may be crystalline structures. If you put the drug as it is like powder or as it is like crystalline structure, what happens? It may absorb the moisture from the environment or it may spoil because of some other microbes which are present in air or some other things. So that is why there should be protection for any dosage form. So our dosage form, whatever it may be a tablet or it may be a capsule or it may be a pellet or it may be a parenteral, this dosage form offers protection to the medicinal substance. So that is the main use of a dosage form. The main merit of the dosage form is that one, that is it offers protection to the medicinal substance and it improves the therapeutic activity of the substance as it provides the maximum drug action to the site and it places the drug directly into the cavities where it is necessary and it provides the main drug action or optimal drug action through injection form and it also improves the bioavailability of the drug. Bioavailability of the drug means what? Bioavailability of the drug means nothing but it improves the activity of the drug in your body. It improves the availability of drug in your body so that your disease or anything, it is treated so fastly. And the next one, you see, the dosage form will also, what it will do, the dosage form, it improves the patient compliance. Patient compliance means nothing but it improves the comfort of the patient. The dosage form improves the comfort of the patient. When you take a dosage form, see, for example, if medicament is prepared, the medicine is prepared for your disease, and if it is like a powder, then you can't handle it, you can't take it properly. So if it is in the dosage form like tablets or dosage form like capsules or dosage form like parenterals, then you can handle it easily. Then you can administer, you can take the dosage form very easily into your body, into your oral cavity or into your parenteral cavity. So this is the advantage of the dosage form. These are the main, this is why we need a dosage form. Next, classification of dosage forms. You see here, classification of dosage forms. The classification of dosage forms, the dosage forms can be classified according to the route of administration and its physical form. So route of administration means what? Route of administration is nothing but from which route you are taking the dosage form. in your body. So you may take dosage form into your body through oral route. You may take dosage form into your body through topical route. You may take dosage form into your body through parenteral route, through rectal route, through vaginal route, and through inhalational route, ophthalmic route, otic route, nasal route. Means based on the route, based on the oral route means what? Based through mouth. Parenteral means what? Through injections. Vaginal means what? Through vagina. Ophthalmic means what? Through eyes. Nasal means what? Through nose. So based on the route of administration, from which route, based on the route of administration, from which route you are taking the dosage form, the dosage forms are classified into different types like oral, topical, parenteral, rectal, vaginal, inhalational, ophthalmic, otic, and nasal. And next, based on physical form, based on the physical structure of the dosage form, the dosage forms are again classified into two types. They are liquids, semi-solids, solids, and gases. Liquids, semi-solids, solids, and gases. So like this, the dosage forms are classified into different types based on the first route of administration or based on the physical form. Next. So now the classification of liquids. Now we see based on the physical form, we can see the classification of liquid dosage forms. Again, the liquid dosage forms are also classified into two types. The liquid dosage forms, the liquid pharmaceutical dosage forms are again classified into two types. They are monophasic liquid dosage forms and biphasic liquid dosage forms. See, in the name itself, it is clearly given monophasic liquid dosage forms and biphasic liquid dosage forms. Monophasic liquid dosage forms means nothing but the dosage form will appear in a single phase. It looks like a single phase. Either it may be a liquid phase. In liquid phase, it looks like a single phase. And biphasic liquid dosage forms means it includes two phases. So that is why it is called as biphasic liquid dosage form. Monophasic liquid looks in a single phase. So that is the difference between monophasic liquid dosage forms and biphasic liquid dosage forms. So see, for example, monophasic liquid dosage forms, the first monophasic liquid dosage form is solution. Solution. So monophasic dosage form mainly refers to it is a liquid preparation which contains two or more components, two or more drug components in only one phase. The two or more drug components, excipients, everything will look in one phase, will be seen in one phase. So that type of dosage form is called as monophasic liquid dosage form, which is mainly example is solution. So you can see the solution. You can see small children, they will be taking this type of solutions for a fever or for cold like that. So that is called as solution. Next one, the solutions are mainly, what is a solution? You see, the solutions are clear homogeneous liquid preparations. Clear homogeneous liquid preparations means what? The solution looks to your eyes very clear. It is very clear. You can see the face with your eyes, and these solutions are homogeneous. Homogeneous means nothing but uniform. The drug content is dispersed in uniform way. So that is why these are called as clear homogeneous liquid preparations, which are intended for internal or external use. Internal use means which you can be taken through your oral route into your body. External use means what? External use means nothing but it can be applied onto the skin of your body. So that is why these are intended for internal, which you can take into your body, or external, which can be applied onto the skin portion of your body. And it contains what? It contains one or more active ingredients. It contains one or more active ingredients which are dissolved in a suitable vehicle. Means it contains one or more active medicaments which is used to cure the disease. It contains one or more active medicaments, and these medicaments are dissolved in a suitable vehicle. Suitable vehicle in the sense it may be dissolved in water, or it may be dissolved in alcohol, like that. It may be dissolved in any vehicle which is suitable with the medicament. So these are called as solutions. Again, you see the solutions are clear homogeneous liquid preparations. which are intended for internal or external use and which contains one or more active ingredients which are dissolved in a suitable vehicle. The components of the solution, see, the solution will contain two main components mainly, that is called as solute and solvent. Solute and solvent. So in solution which is present in large proportion is called as solvent, and which is present in small quantity is called as solute. So here solute is nothing but the medicament which you will take, and solvent is the vehicle. This medicament is dissolved in the solvent. So that is why medicament is in smaller proportion and solvent is in larger proportion. So this is about solution. So this is about solution. Solutions are clear homogeneous liquid preparations which are intended for internal or external use and which contains one or more active ingredients. In solution, what are the two important components? The first important component is solvent, which is present in large proportion, and the second important component is solute, which is present in smaller proportion. So this is about solution. Next, you see the classification of monophasic liquid dosage forms. So monophasic liquid dosage forms are classified into different types again. These monophasic single phase liquid dosage forms are classified into different types again. You can see the classification chart in the slide. So the first one is the liquids which are meant for internal administration. Liquids which are meant for internal administration. Internal administration means what? Into the body, which can be taken into the body of a human being. So what are those? The first one is syrups, and second one is mixtures, and the third one is elixirs, and the next one is linked uses. Syrups, mixtures, elixirs, linked uses. And the second type of classification is the liquids which are meant for external administration. The liquids which are meant for external administration means which can be externally taken. What are those? The liquids which can be applied to the skin. First one, that is lotions, liniments, collodions, and paints. And the liquids used in mouth. Liquids used in mouth means gargles, mouth washes, and throat paints, which can be taken into mouth and which is thrown out of your mouth after gargling. So those are gargles, mouth washes, and throat paints. And the liquids instilled into the body cavities, the liquids which can be taken directly into the body cavities. What are those? Douches, ear drops, nasal drops, eye drops, and enema. This is the classification of monophasic liquid dosage forms, and now we will see one by one. The first one you see syrups. Syrups. What are syrups? Syrups are the aqueous preparations. Aqueous preparation means what? Aqueous means the vehicle used is water. So that is why these are called as aqueous preparations, and which contains 60% to 85% of sucrose. These syrups contain 60% to 85% of sucrose with or without flavoring agents. Means some syrups may contain flavoring agents. What are flavoring agents? Flavoring agents are nothing but which gives you the smell, which gives you nice flavor, nice smell. So with or without flavoring agents and medicinal substances. Example, chlorpheniramine maleate syrup and chloral hydrate syrup. So these are the syrups. Syrups are aqueous preparations which contain 60% to 85% sucrose with or without flavoring agents and medicinal substances. Example, chlorpheniramine maleate syrup and chloral hydrate syrup. And these are again two types. They are flavored syrups and medicated syrups. So flavored syrups means nothing but which contains a flavor. Medicated syrups means nothing but which contains a medicinal substance. So this is about syrups. Next one, mixture. So what is a mixture? Mixture is nothing but it is a liquid preparation which is meant for oral administration. Which is meant for oral administration means which can be taken through mouth, in which medicaments are dissolved or suspended in a vehicle. Means the medicament, if you take any paracetamol is there for fever, the paracetamol is dissolved in water. Suitable vehicle means water here. So paracetamol is dissolved in vehicle and can be taken. So that type of dosage form is called as mixtures, and these cannot be used for long period of time. These cannot be used for long period of time. These are not stable for the longer periods of time. So that is why this should be not used for longer period of time. And when it is prescribed, the doctors prescribe this type of mixtures when the patient is getting cough and he is having some digestion problems or diarrhea, loose motion problems. Like that, the doctor will prescribe this type of mixtures. Next one, elixirs. So what are elixirs? Elixirs are nothing but these are clear, aromatic, sweetened, hydroalcoholic solutions. Elixirs are nothing but these are clear, aromatic, sweetened, hydroalcoholic solutions with or without medicinal substances. So clear means they look clear, aromatic means with good smell, sweetened means with a sucrose, and hydroalcoholic solutions means alcohol is mixed with water here and medicinal substance is added into the compound. So that is why these are called as clear, aromatic, sweetened, hydroalcoholic solutions with or without medicinal substances, and these are mainly intended for oral use, for taking it through the oral route. Example is dexamethasone elixir. So here the vehicle, mostly we use the vehicle ethanol or sucrose, which is having antimicrobial property, means it cannot accept microbes into it. So that is why it is having antimicrobial preservatives. So this is about elixirs. Next one, linked uses. So what are linked uses? Linked uses are nothing but these are viscous. Viscous means what? Viscous means nothing but thick in nature. For example, if you see honey, how honey will look like? Honey is very thick. When normal water is thin and dilute. So that is dilute content is water, thick content is nothing but thickness is measured in pharmaceutical terms. The term is viscous. So thickness can be referred as viscous. So linked uses are viscous oral preparations generally prescribed for cough. These linked uses are mainly prescribed, mainly given for the patients who are suffering with cough. Example is codeine linked use. Here, codeine is the drug which is used. And these linked uses mainly contains medicaments which can be act as demulcents, sedative, and expectorant. Demulcent, sedative, expectorant is nothing but these medicaments may relieve the pain. These linked uses may relieve the cough, and these linked uses may relieve they may cause sedative action. Sedative action means nothing but it may cause sleeping sensation in the human being. The human being may sleep, he may get sleep after taking these linked uses. So this is about linked uses. Next one, lotions. So lotions, you know very well. The lotions are the main liquid preparations which are externally applied without friction. You should understand this meaning. Lotions are liquid preparations which are applied without friction. Without friction means you should not rub. When you apply lotion, you should not rub with your hand. You just apply the lotion and you take it out. So that is the process of applying the lotion. You should not rub it. So mainly what is the action of these lotions? It mainly acts as cooling agent, soothing agent, and protective agent against the sun rays. Next, liniments. Liniments are the liquid preparations which are mainly externally applied to the skin with friction. So these liniments are applied with friction, and lotions should not be applied with friction and rubbing, but the liniments are to be applied with friction and rubbing. Means you have to rub. When you take this liniment, when you apply this liniment onto the skin, you have to rub the portion there with this liniment. So these are alcoholic or oily solution. They are called as liniments. Next one is collodions. So what are collodions? You can see there, collodions. Collodions are liquid preparations which have to be taken for external use, which contains pyroxylin, which is mixed in ethyl ether and alcohol. This pyroxylin drug is mixed in ethyl ether and alcohol. Ethyl ether and alcohol are the vehicles here, and pyroxylin drug is mixed in ethyl ether and alcohol, and they are externally applied onto the skin like that. So what is the use of these collodions is nothing but it protects the wounds and cuts. So when some cut is happened in your body, or when some wound happens on your skin, then you have to apply these collodions. These collodions contain the drug pyroxylin, a mixture of ethyl ether and alcohol. Next, gargles. You see gargles. Gargles are nothing but these are aqueous solutions which prevents throat infections. Means what you have to do, you have to take this gargle. You have to take this gargle into your oral route, and you have to take this out after gargling for some time, then you have to throw that water outside. So those are called as gargles. Next. Next one is gargles. Next one is mouth washes. So we are losing the time. Only last 10 minutes is there. You see, we will finish this one. Next one is mouth washes. So mouth washes are the aqueous solutions which with the pleasant taste and odor. These mouthwashes contains good taste and odor. These are nothing but these are antibacterial and pleasant solutions. Like how you brush your teeth with the toothpaste, these mouthwashes are also useful as toothpaste. You just have to take this mouthwash into your mouth and you have to gargle it and you have to throw it outside. Then that will act as a toothpaste. It will clean your mouth. Next one is throat paints. These throat paints you have to take into throat. These are liquid preparations. These are liquid preparations which can be taken into your mouth. And glycerin, here we use glycerin as a base, and you have to take it to throat and you have to gargle it and you have to throw it outside. Next one, douches. Douches, you can see here, douches is a medicated solution which is mainly meant for rinsing the body cavity. Douches are nothing but these are like antiseptic solutions. So to clean your wounds like that, we will take these douches. Next, ear drops. Ear drops are the aqueous solution, you know very well. These are taken into the ear when you are having some ear infection. Nasal drops. Nasal drops are also the aqueous solutions which are taken into the nose through a dropper. So to clear your nose infection. Next, eye drops, same thing. Eye drops are also the sterile preparations which can be taken into your eye. So this is very important, eye drops. Eye drops should be sterile, means it should not contain any microbes. Eye drops should not contain any microbes. Why? Because you are directly taking into eye. So if they are not sterile, if they are not perfect, then it may damage your eyes. So that's why it should be sterile. Next. Enemas. Enemas are aqueous oily solutions or suspensions which are directly given into rectum of your body. Enema, you know, in government hospital, it is called as enema. Enema means nothing but if the children or anyone is not getting motions frequently or if they swallowed something, then they will give this enema through the rectum portion or anus portion. They will put this enema into the children. When they put enema into the children, immediately within 5 minutes, they will get loose motions. So that is the example for that. So this is about monophasic liquid dosage forms. Up to now, we have seen regarding monophasic liquid dosage forms. In tomorrow's class, we will discuss regarding biphasic liquid dosage forms. So, okay, if you get any doubt, you can ask me now.